Very good afternoon to you, Mr. Lalloo, and thank you so much for your time this afternoon. So what more can be done to ensure that the rollout happens speedily and effectively?
So good afternoon, and thank you for having me on. I think many of the issues have already been raised. Certainly, I think there needs to be transparency, as we indicated in a previous interview. So, my problem is that government needs to keep the population informed. So there should be a vaccine watch. So that's the first issue. The second issue is, as you pointed out, we are dependent on how quickly we can access vaccines. And if the issue is funding, then I think we need to bring in the private sector, particularly the medical, private sector, the medical aids, to participate in this. And I'm sure many of the members of medical aids would be willing to pay for the vaccine, because we must embrace the principle that getting vaccinated against COVID-19 is a right, not a privilege. So far, I think the Sisonke program appears to be running well, but the problem is transparency. In other words, we were not informed that this was indeed a phase 3B trial. Initially, it only became apparent later. What was also not clear during that rollout is who were the actual participants that were invited to participate. So, for example, in KwaZulu-Natal, it appeared that only certain doctor groups advocated to participate, and then if you didn't belong to that group, it was very difficult to actually get enrolled into that program. So there needs to be transparency, and there needs to be an investigation into how that rollout happened, so that in the future we can learn some lessons and then ensure that we don't make those mistakes. So there needs to be governance. And there have been reports that people who did not qualify, for example, frontline workers, such as intensive care nurses, were left out, and other healthcare professionals who were not directly involved with COVID cases actually got vaccinated in the first sort of rollout. So I think there's lots of lessons to be learned. Certainly, I think we all face the challenges, and I think government needs to be transparent in its rollout, and I think as citizens we need to comply and participate in the program, but there needs to be transparency in terms of how do you get onto the program, which groups would be involved. And I think the simplest way is to use the HPCSA registration roster to decide, how to enroll the healthcare workers, because the next challenge is going to be, once a substantial amount of healthcare workers have been vaccinated, then you've got to look to the general population. And I think if government is transparent in how it's going to roll that out, I think there would be better cooperation and understanding from the public. And I think we would then achieve the targets we want to, notwithstanding the challenges of getting the optimal number of vaccines for the population.
Umesh, could it be a matter of that government is experiencing challenges that they themselves don't understand and don't know how to deal with, and that is why they're not able to properly and adequately give us the answers that they should be giving us, that there needs to be this transparency, because they maybe themselves don't understand why they're experiencing the issues they are?
No, I don't think that's the issue, and I don't think it's fair to expect one to criticize government. But I think there must be many lessons that we've learned, and I'm sure that government has the best intentions of its population and to protect its population against the ravages of COVID-19, the vaccination being the most important weapon we have at the moment. So if government is transparent in the way it's doing it, it invites the various sectors that can assist it, such as the medical aids, the private sector, all work in collaboration. And we must be very clear about who would be eligible at which stage. I think it would help a long way. And I do believe that government is doing its level best. And like I said, he has an opportunity now, after the experience with the first round of vaccines, to do a kind of study to understand where the problems were, what kind of governance issues are involved, and how we can improve it. And I think we all need to work together to get this vaccine program underway and running efficiently. So I don't think it's a question of government not understanding. I think here's an opportunity then, just to recap, to understand what challenges we faced, how to deal with it, so that we all work together to get this underway, because this is our saving grace.
And just quickly before I let you go, Umesh, is it problematic that they may not reach the targets that they are aiming for in terms of inoculation? Let's say they're looking at, I'm going to give a random figure of 10 million people by the end of 2021. Would it be problematic if they don't reach this target, given that they are dealing with something that they themselves are learning as they go?
Yes, I think the world over, if you put that question to any country, developing or developed countries, if you don't achieve your targets, the price you pay is the ravages and the mortality and the cost to the country with the COVID pandemic. So I think we have to, call on all our resources, whether it's financial, whether it is human, to get this rollout done. So, and I'm sure we can achieve it. I think South Africa has faced many challenges. It had one of the largest HIV, ARV rollout programs in the world. And I think we're very experienced. So I think if we put our heads together, our resources together, we will achieve it. And the bottom line is, if we don't, then the price you pay is the cost to the healthcare system, to the country, in terms of morbidity, mortality, economic loss, is immense. So I think we cannot afford not to make this work, and I'm sure it is achievable.
Umesh, thank you so much for your time.